Hi everybody, my name is Niels Buus and I'm the St. Vincent's Chair of Mental Health Nursing and the Director of the Centre for Family-Based Mental Health Care. I'd like to introduce you to the St. Vincent's Open Dialogue initiative, which is about to commence. We will be working with implementing open dialogue principles at 4 sites across New South Wales. The participants are the Blue Mountains Access Team. This team is based at the Katoomba Community Health Centre, and it provides community-based assessment and support to people experiencing a range of acute mental health issues. It's the Nepean Blue Mountain Assertive Response Outreach Team, also known as the ARROW team. The goal of ARROW interventions is to reduce or avoid hospital admissions by enhancing community care. The ARROW team provides assertive and intensive therapeutic interventions for children and adolescents aged 5 to 18 who are experiencing either acute behavioral or mental health problems. Then there's the Nepean Blue Mountains Early Psychosis Intervention Program, also known as the EPI team. And the EPI team provides direct clinical services to a target population aged 12 to 25 who are either experiencing or at risk of experiencing a first episode psychosis. Finally, there's the U-Space ward at St. Vincent's Private Hospital, Sydney, which is designed specifically for young adults aged 16 to 30 with emerging and/or severe mental health problems. Open dialogue is not a structured model. It does not easily lend itself to be manualized. Rather, it's an approach to mental health that needs to be adopted to the particular local conditions. In October and December 2016, we'll roll out a teaching course about open dialogue and have 5 workshops at each of the sites discussing how an open dialogue approach might be adopted into the local setting. In January and February 2017, we'll have an intensive open dialogue training course where staff can choose to participate for 3 or for 5 days. The course will be for all professional groups at the 4 sites. At this point, we anticipate that staff at the 4 sites will have discussed at length how to implement some of the open dialogue principles and that they've started implementing these new initiatives. As a way of supporting these initiatives, we have organized open dialogue supervision for 18 months. The supervision will be organized the same way as open dialogue, which means, for instance, that there'll be 2 supervisors acting as reflective teams. We have also organized research of the implementation processes. The first study is about measuring staff's burnout, their general health, and their psychosocial work conditions, health and well-being. We're going to survey these measures at all sites at 4 points in time to see if they can explain how the different sites choose to adopt or the level at which they engage with the new open dialogue principles. We're also going to audio record the workshops. This has got 2 purposes. The first purpose is to be able to feed back from one workshop to the following workshop at a site what their concerns were and how they worked with it the previous time. This will increase the level of depth and focus their discussions. The second purpose is to research how staff at different sites have different concerns and to compare these sets of concerns across sites. We're going to have an ethnographic field worker working at USpace, looking at their clinical practices and to what extent they're successful in adopting open dialogue practices into their existing practices. Then we'll have a series of case studies of patients and families receiving the open dialogue intervention. The purpose here is to explore how people who are subjected to open dialogue are pushed through the system. And finally, we're going to audio record some of the supervision processes to be able to characterize what open dialogue supervision consists of. There'll be many more opportunities to do research, and we'd like to encourage people to come forward if they want to research part of this implementation process, or if they'd like to add analysis to the data that we are already collecting. This implementation study is the first step in a much larger initiative looking at how we can implement open dialogue across New South Wales. The second step will be about bringing open dialogue courses to Sydney. First of all, a comprehensive open dialogue course lasting 3 years, and secondly, a train the trainer course lasting 2 years. The idea here is to train a group of highly committed and specialist clinicians who will be able to train the next generations of open dialogue clinicians. This will be instrumental in the third steps, which will be about developing Australian-based foundation courses in open dialogue for both professionals and for peers, and use these training courses to scale implementation of open dialogue up. And it's in this third step that we will be able to utilize more quantitative measures and more rigid research designs to decide which effect open dialogue has in the Australian context. We're very interested in collaborating with anyone with an interest in open dialogue. You can see my contact details here. And I'd like to acknowledge that the St. Vincent's Chair of Mental Health Nursing and the Centre for Family-Based Mental Health Care are generously supported by the Grant Family Charitable Trust and the Michael Crouch Family Trust. Please do not hesitate contacting me if you've got any questions regarding the implementation study or inquiries about collaboration. Thank you for your attention.